Hi, I'm Dr. James Machino, and I want to talk to you about vitamins and minerals that are helpful in the management of premenstrual syndrome, or PMS. You know that PMS, or premenstrual syndrome, is sort of a cluster of variable symptoms that some women get about 7 to 14 days before menstruation. And some women even get, painful menstrual cramps with this, so it can all be tied in together. That's a condition known as dysmenorrhea, when they have painful menstrual cramps. And about 1/3 of women are affected by this who are premenopausal women. And it's usually most severe when women are between the ages of 25 and 40. And about 10% of women have really severe debilitating symptoms. So it's quite prevalent. And the cluster of symptoms that women can experience can be, from emotional to physical. So in the emotional spectrum, sometimes there's increased nervousness or anxiety, irritability, fatigue, lethargy, mood swings, even depression, which of course is the scariest one. And then in terms of intestinal symptoms, bloating is very common, cravings for sugar or chocolate. Some women claim this happens to them. And changes in bowel habits like constipation, diarrhea. Reproductive tissue can be affected, breast tenderness, breast swelling, menstrual cramps, change in libido, other physical manifestations. Some women get headaches at this time in the month, or backaches. There can be swelling of the extremities, the fingers, the ankles, not uncommon. So, what's causing this sort of array of different things to happen? What is the most consistent finding in PMS is that there's a high estrogen to low progesterone ratio. So the balance of estrogen to progesterone is off. Too much estrogen, not enough progesterone. How does this happen? Well, you can produce too much estrogen from having faulty dietary behaviors. You can produce too much estrogen, actually. Or the liver's not detoxifying the estrogens that you have fast enough, which can also be manipulated through diet and activity. One of the other things that can happen is some women have sort of ovarian failure where they don't produce enough progesterone. And there are ways to balance that out as well. But the impact of the high estrogen to low progesterone has an impact on different body systems. So in the brain, it starts to lower endorphin levels. So you get mood swings and depression. You don't feel like the same person. That imbalance of estrogen and progesterone can cause an increased release of prolactin, which causes breast tenderness, breast swelling, and account for some of those symptoms. And it can also cause an increased release of aldosterone, which is a hormone that holds water and sodium in the body, and the swelling and the bloating and some of that discomfort comes from that effect. So, are there any vitamins and minerals that have been shown to be helpful in managing PMS naturally? And the answer is yes. There are clinical studies showing the value of certain supplements. So, for instance, vitamin B6, there are more than a dozen double-blind studies showing the impact of vitamin B6 supplementation in the treatment of PMS. Why would you even test B6? Because it's a cofactor in estrogen detoxification in the liver. Without enough B6, you can't remove enough of the old estrogen. B6 is also required for neurotransmitters in the brain that affect your mood state. And so if there's not enough B6, you're going to be more susceptible to the impact of the imbalance. B6 is also required to make anti-inflammatory hormones, or prostaglandins, that suppress the inflammatory response, helping to deal with breast pain and other sort of inflammatory components of PMS. In some of these investigations, B6 has worked best with other B vitamins like niacin, folic acid, vitamin B12. And so some people think taking a B complex with the B6 is the best way to go. And because in many of the enzyme systems that use B6, you also need magnesium, some studies have combined B6 with magnesium to produce a very significant effect. Also, vitamin E is useful. Double-blind studies show that vitamin E can help reduce many of the symptoms of PMS, including nervous tension, headache, fatigue, depression, insomnia, breast tenderness, anxiety, even food cravings. Vitamin E modulates prostaglandin hormones directly, and it also helps cells fully mature as they're developing and slows down the rate of cell division. So this can help to mitigate some of the pain and hyperproliferative activity in the breast, decreasing some of that response, and also taming some of the uterine symptoms as well. And vitamin E has also been shown to regulate reproductive hormones to a certain degree, helping improve PMS and fibrocystic breast disease. And calcium and magnesium supplementation at the right dosage has also been shown to be extremely helpful. It has been shown to reduce the symptoms of PMS by up to 50% if you take it during a long enough trial course. So you need to know the right dosage of the B vitamins, the right dosage of vitamin E, the right dosage of calcium and magnesium. And there's other herbal agents that have been shown to be useful, as well as other lifestyle strategies if you want to manage this naturally, which is how I suggest you do it. Remember that most medical doctors have not really studied a lot of nutrition and natural medicine. They haven't seen this information. So they tend to just prescribe certain medications to manage PMS, but the idea is to naturally bring the estrogen-progesterone ratio back into balance, calm the symptoms that are really the root of the problem by getting to that imbalance. So what I've done is I've put together an ebook that you can download right here for free. It's called The Natural Management of PMS. Every woman should read it. If you have any PMS symptoms at all, download the book and read it right away, because this is where you're going to get really sound scientific information that's based on real clinical trials with humans. So on that note, what I want to tell you is that at machinohealth.com I have other research review papers, other videos, I have footage from my live seminars, other resources and downloads that I've created, all for free, that will help you lead a long, healthy, functional life. And all my research papers and teaching materials come complete with scientific references, so you'll know you're getting only evidence-based information from me that's sound and solid. So if you're searching for any health or wellness information, I hope you'll make machinohealth.com an ongoing, reliable resource for both you and your family. Thanks so much for watching.